Blood Transfusion, Part 2. In this video, we will be discussing about, first, pre-transfusion procedures, such as consent form and checking of the vital signs. Second, main steps in blood transfusion. Third, post-transfusion procedures. And fourth, possible complications or side effects of blood transfusion. Pre-transfusion procedures. After blood transfusion is indicated as part of the treatment plan, compatibility and biological tests are done. Then, when the results are obtained, the required blood is ordered from the blood bank.
So, hello, Catherine, right?
Yes, doctor.
Okay, so Catherine, I just got your test result back. My name is Dr. Bernadette, and I am going to be in charge of your blood transfusion today. So, how are you?
Actually, I'm a little nervous because this is my first time receiving blood.
Well, Catherine, it's totally normal to be nervous because this is your first time receiving blood, right? But I can assure you that you don't need to worry too much because we are going to monitor you. We will be with you throughout the whole process. And if you're feeling unwell, we will be with you too, okay? So, okay. Now, before we proceed with the blood transfusion, I am going to explain you about what we are going to do today, about why you are actually receiving blood today, and also what we are planning to do with you and what you have to do today with us, okay? Are you ready?
Yes, doctor, I'm ready.
Okay, good. Okay, now, why you need blood transfusion is because you have been experiencing dizziness, weakness, shortness of breath, right?
Yes, these symptoms actually disturb my daily activities.
Yes, of course, it will disturb your daily activities. So, I take one of your symptoms, which is dizziness, okay? So, as we know that blood, red blood cell, actually carries our oxygen throughout our whole body, right? So, what happened here is, in your blood system, you are lack of red blood cells. And in medical terms, we call it as anemia, okay? So, what happened is, in your case, anemia, you don't have, you are lack of red blood cell. So that is why, the reason why you have been feeling this dizziness, weakness is because there are insufficient number of oxygen that are carried through your body, that are carried through to your brain. So your brain is actually lacking oxygen. That is why it can function normally. You are feeling dizzy because you are lack of oxygen, lack of red blood cells. Okay, so that is why we are helping you by blood transfusion. So what happened is, we are going to transfuse blood into your blood system. Okay, from the donor's blood into your blood system, so that in this way we can increase the red blood cells inside your blood system, so that when your red blood cells increase, okay, and it will eventually helps you, so that all these symptoms that you've been feeling will subside, and your daily activity won't be disturbed too much as you have been feeling lately. Okay, up until this point, everything clear?
Yes, doctor, all clear.
So, next, Catherine, I'm going to tell you about what are the possible complications, okay? Complications or side effects that you might have when you are receiving blood transfusion, okay? The most common one, and it actually happened within 15 minutes after we started blood transfusion, are fever or urticaria, which means, have you ever seen red spot on your skin? And it's when you are having allergic, there will be like red spots on your skin, and then it will, start to be itchy.
Yes.
Okay, that's urticaria. And then might also be chills. Okay, you might be shivering. So that is why the first 15 minutes after we started blood transfusion, we are going to infuse the blood slowly so that we can control the possibilities of you having a reaction towards the blood that has been transfused into your body, and we can stop the transfusion immediately, okay? And the other possible complications are like bloodborne infections, such as HIV, hepatitis B, hepatitis C. But then these are rare, but it might happen, okay? And also delayed or acute immune hemolytic reaction, okay?
What is immune hemolytic reactions?
Immune hemolytic reaction is when your immune system is actually attacking the red blood cells that are newly infused into your blood system. So it might happen, okay? It might happen, but sometimes it doesn't happen.
Okay, and may I know how the procedure will be, doctor?
Well, of course, I will explain to you as simple as possible so that it will be easier for you to understand. So, Catherine, after I explain you about everything about blood transfusion, you're going to sign a consent form first, stating that you agree to take blood transfusion, okay? And then after that, what we're going to do is we're going to prepare you for blood transfusion. Firstly, what we're going to do is we're going to check your vital signs, like blood pressure, your temperature, your respiration rate, and also your pulse, to make sure that you are stable and you are able to tolerate with blood transfusion, okay? And then if everything is fine, we will proceed to the next step, which is the infusion of normal saline, okay? It's a saline solution. We are going to infuse to you through IV line access. You are right or left-handed?
I'm left-handed.
Left-handed. So on your right hand, on the antecubital fossa, here, we are going to make an IV line access. Okay. So we're going to infuse the normal saline first. After that, after normal saline infusion, then we start with blood transfusion. In the first 15 minutes, we are going to infuse the blood slowly into your blood system, so that we can control if there are any reaction towards the transfused blood. So we are going to check your vital signs again to make sure that you are stable. If your body is tolerating the transfused blood, then we can continue the blood transfusion. Okay?
Okay, so if I feel unwell and I have to tell immediately, right?
Yes. As soon as you feel like you're feeling unwell, something is not right, you just have to tell us immediately. Okay?
Okay, I understand. And how long will the process be?
Okay, so the process usually will take place around 4 hours. We cannot exceed 4 hours. So I would say in 4 hours, within 4 hours, we're going to finish everything.
Okay.
Yes. Okay. Now, what we're going to do is... Oh, sorry, before we go to the consent form, do you have any other questions? Unclear questions you want to ask? No? Everything is clear?
Yes.
Okay, so Catherine, what you're going to do now is we're going to give you a form and read everything. If you don't understand, you can ask me, and then if everything is okay, then we can sign the consent form. Then we can start preparing you for blood transfusion, okay? Take your time.
Patient must be comfortable, whether in a lying or sitting position. Then, a wristband is given to patient with these details: name, age, gender, blood type, and Rh factor information. Double verification. It has to be done by 2 persons, 2 nurses, or a doctor and a nurse. Double identification means one person is reading the details and the other is listening, and vice versa. Firstly, compare information on the blood bag with the blood transfusion form of the patient.
I have George 2 IPRN Cathara, GEORGETWO-IPRN, CATHOURA, date of birth 12/8/60. Patient is O positive. He is receiving O positive, cross matches compatible, unit number W300220125144. Blood expires January 20th, 2021, and he is receiving packed red blood cells.
I have a unit of packed red blood cells for George 2 IPRN Cathura, GEORGETWO-IPRN, Cathura, CATHOURA, unit number W340220125-144. Recipient is O positive, donor is O positive, cross matches compatible, expiration 1/20/21. Now compare the bag to the patient's wristband and the blue blood bank band.
I have George 2 IPRN Cathara, GEORGETWO-IPRN, CATHOURA, date of birth 12/8/60, medical record number 216000015, blue blood bank band ID Y734813.
George 2 IPRN Cathura, GEORGETWO-IPRN, CATHOURA, MRN number 216000015, date of birth 12/8/60, blue blood bank band number Y734813.
When the ordered blood arrived in the transfusion room, blood transfusion has to be done within 30 minutes. After 30 minutes, the blood is no longer viable. So, it is important to make sure that the pre-transfusion procedures are completed before the blood arrived. Blood transfusion has to be done within 4 hours. The duration of the blood transfusion must not exceed 4 hours to prevent unnecessary complications for the patient. Pre-transfusion vital signs examination. The vital signs of the patient has to be monitored. The blood pressure, respiration, temperature, and pulse of the patient are recorded before transfusion takes place. This is to make sure that patient is stable and able to undergo blood transfusion. Next is preparing and assembling required equipment. Required equipment are biohazard bag, alcohol pads, blood tubing, white tubing, blood product, 500 cc bag of normal saline, and 10 ml saline flush. Assemble supplies before entering the patient's room. Transfusion steps are as follow. Assure patency of IV line. Hang normal saline flush bag. Spike normal saline bag and prime tubing, filling blood tubing filter. Caution: close normal saline roller clamp. Spike blood bag. Open blood roller clamp and prime tubing. Be sure to prime the entire line. Connect IV tubing to patient's IV access. Set pump to deliver blood at no more than 2 ml per minute for 15 minutes. Monitor patient for adverse reactions. Measure vital signs after 15 minutes. Increase infusion rate after 15 minutes per MD order or facilities policy. Measure vital signs when infusion is complete. Disconnect blood tubing. Flush IV line. Note patient's response to transfusion. Discard tubing and blood bag. Dispose of soiled supplies. Post-transfusion procedures. After transfusion, patient is required to stay in the hospital for another 3 hours to be monitored. If patient is stable and there are no signs of rejection of the transfused blood, patient can be discharged.